Hello ladies and gentlemen and welcome to Med Minute. I'm Veronica Hernandez. Tonight we have a guest who is here to share about a recent experience and a new medicine on the market.
Hello everyone. My name is Papa Jimmy and I would like to talk to you about a new medicine that I have recently taken. See, I was hospitalized for pneumonia a few weeks back. I was not able to get out of bed for a while, so my doctor prescribed this medication to keep me safe from blood clots.
What medication were you taking?
The medication is called Bevyxxa and it is produced by Aportola Pharmaceuticals.
What is Bevyxxa? I haven't heard of that medication before.
Bevyxxa is a factor 10A, or FXA inhibitor and is indicated for the prophylaxis of venous thromboembolism, commonly referred to as VTE. It was recently approved to be used in adult patients hospitalized for an acute medical illness who are at risk for thromboembolic complications due to moderate or severe restricted mobility and other risk factors for VTE.
What is a factor 10A inhibitor?
It keeps factor 10 from taking part in the clotting cascade. This action decreases blood clot formation.
How is Bevyxxa supplied?
The generic name is Bevyxxa. The medication is available in 40 mg and 80 mg capsules. The 80 mg come in size 2 hard gelatin capsules that are light gray with 80 printed in black, and have a blue cap with PTLA printed in white. The 40 mg come in size 4 hard gelatin capsules are light gray with 40 printed in black, and have a light blue cap with PTLA printed in white.
How is the medication dose determined?
The recommended dose of Bevyxxa is an initial single dose of 160 mg, followed by 80 mg once daily. Daily oral doses should be given at the same time of day, with food. The recommended duration of treatment is 35 to 42 days.
Okay, that seems pretty easy. Is it okay to use for children?
This medication has not been recommended for use in children. Bevyxxa is also contraindicated in patients with active pathological bleeding or severe hypersensitivity reaction to Bevyxxa.
Are there other people who should avoid taking Bevyxxa? Pregnant women or nursing mothers?
There is no data with the use of Bevyxxa in pregnant women, but treatment is likely to increase the risk of hemorrhage during pregnancy and delivery. For this reason, Bevyxxa should be used during pregnancy only if the potential benefit outweighs the potential risk to the mother and fetus. There is also no data available regarding the effects of the drug on the breastfed infant, or the effects of the drug on milk production. The developmental and health benefits of breastfeeding should be considered along with the mother's clinical need for Bevyxxa. Any potential adverse effects on the breastfed child from Bevyxxa or from the underlying maternal condition should be carefully considered before taking this medication.
How does patient age affect the medication?
No clinically significant differences in safety or effectiveness were observed between older and younger adult patients.
How about renal and hepatic patients? There are often changes to medication dosing for people with kidney or liver problems.
Because of an increased risk of bleeding events, adjustments will need to be made for patients with severe renal impairment, which is indicated by a creatinine clearance of greater than or equal to 15 ml per minute but less than 30 ml per minute computed by the Cockcroft-Gault formula using actual body weight. For these people, the initial single dose is 80 mg followed by 40 mg once daily. You should be monitored closely and promptly evaluated for signs or symptoms of blood loss. No dose adjustment is needed for mild or moderate renal impairment. Bevyxxa has not been evaluated in patients with hepatic impairment, because these patients may have intrinsic coagulation abnormalities. Therefore, the use of Bevyxxa is not recommended if you have liver impairment.
How is Bevyxxa absorbed at the cellular level?
Bevyxxa is a substrate of P-glycoprotein. So, if you take a P-glycoprotein inhibitor such as amiodarone, azithromycin, verapamil, ketoconazole, or clarithromycin, an increased exposure of Bevyxxa will occur. For this reason, a reduced dose of Bevyxxa is indicated if you are taking or start taking these medications. Co-administration of anticoagulants, antiplatelet drugs, and thrombolytics may increase the risk of bleeding. You should promptly seek evaluation for any signs or symptoms of blood loss if also taking anticoagulants, aspirin, other platelet aggregation inhibitors, and/or nonsteroidal anti-inflammatory drugs.
What side effects have been identified with the use of Bevyxxa?
The most common adverse reactions with Bevyxxa were related to bleeding, with major bleeding occurring in less than 1% of patients. Other reactions include urinary tract infection, constipation, hypokalemia, hypertension, headache, nausea, and diarrhea.
Well, Papa Jimmy, that sounds like an interesting new medication. Thank you for sharing.
Thank you, Veronica.
This has been Med Minute. Once again, I'm Veronica Hernandez. Have a wonderful evening.